welcome everybody to our pelvic floor and women's health Q&A. I'm just going to introduce myself really quickly. Joanne Wolf, Dr. Joanne Wolf. I'm the owner of Wolf Wellness Physical Therapy. It's a practice that is usually based out of DC, but I've been in Chicago the last 2.5 months of quarantine. And Zahava and I have been so excited to collaborate for years. I grew up with her husband, so it's been so fun to finally kind of like let's see this come into fruition. We both have really similar like belief systems of how the body works and how holistic we want to approach our treatments, both for ourselves and our families, as well as all of our patients that we see. So for today, I just wanted to talk a little bit about my women's health specialty. I see a lot of different kinds of patients, anything from athletes and general orthopedics and rehabilitation to concussions. And one of my passion points is women's health, pelvic floor therapy. I don't have any kids myself, but I've seen a lot of patients over, the course of the last 5 years of treating people. And it's just always been the most powerful demographic of patients that I've seen, and the amount that you can do, even as a patient for yourself in self-treatment is really amazing. So from everything from the internal manual work that I do to a lot of patient education, I've just found all the techniques and the tools and just the amount that I learned from my patients about these issues. It's such an under discussed and exposed topic. And so I'm really excited to be here with you, Zahava. And I want Zahava to introduce herself because I know this is her account, so everybody's probably like tuned in already. But Zahava, like what's your like backgrounds and what's your interest with like women's health stuff?
So I'm so excited to be doing with you. First of all, we've always talked about a collab forever, and it's so nice to know a physical therapist too that has the same like belief systems, and our theories and our philosophies like on the body and on women are so aligned with each other. So it's just really exciting for me to even be talking to you. But so I am Zahava. I am an acupuncturist. I got my doctorate about 2 years ago, and I have my own practice here in Chicago called Chicago Family Acupuncture. We have a Glenview office and an Evanston office, and we are opening back up soon, hopefully, too. So that's our exciting news. But my passion lies with women's health, all things women's health, like really to see women from like puberty through like just old age, supporting them through the life cycle. So whether that's, menopause, fertility, whatever women are, when they're in transition and struggling, that's really like my goal is to try to like help them through, like care for them. And again, like acupuncture, there's so much education I think that I do when it comes to just acupuncture and what people need to know about it. But there you are.
Sorry.
That's okay. So much of what I'm doing is, just educating people about their bodies and how the mind, body, and soul are just really one thing. You can't separate them out. And again, like we're all, especially now, all stressed, and I think we all need extra support. But the reason I really wanted to do a pelvic floor talk is because I've experienced my own pelvic floor issues and have sought physical therapy for it. And I've been telling all my patients about it. I think it is so important for every single woman. I mean, men too, honestly, but we're focusing on women, but this does apply to men because they also have pelvic floor issues, right? And you'll talk about that more, I'm sure. But, I just really, really believe that women should know about this, and whether people think about kids and whatever, it doesn't matter if you have kids or not. Like it's so important for everybody to know about their own pelvic floor health and what they could do now to like prevent issues later as well. So I'd like to jump in, and I'd love if you can share for us like what is the pelvic floor. Most people don't know what it is, and so I'd love to hear from like your Western point of view, like what are we even talking about?
Yes, and like you said, like the Western and the Eastern, there's all these amazing bridges, and so I'm really excited to be able to talk about those and kind of have this back and forth with you. But I think let's start just generally, like what are pelvic floor dysfunctions in general? Let's just kind of start with that topic of it being sort of an umbrella topic that can include so many different conditions and dysfunctions. So it can be anything from stuff that we're going to talk about today with urinary incontinence, so like any kind of leakage, or like stress incontinence, or not even being able to go. So leakage when you like sneeze, or you just kind of leak consistently without any pressure. So there's all these different kinds of incontinence. Then pelvic floor dysfunction can also mean like pain with sex, or just pelvic pain in general. So that's a lot of different like issues that you can have, but all stemming kind of from these like pelvic floor dysfunction, mechanics. Or there's obviously like neurological components. There's more serious issues that could come up, like if there's cysts or growths, or like like tumors or things like that. So there's obviously more serious issues that you want to make sure that you get checked out and you get all of your testing done and your imaging done if there are all these other more red flag symptoms that are coming up. But once you have all of those sort of more superficial, more serious things ruled out, a lot of people find they just don't really know what's wrong, and they've accepted like, oh, it's normal to pee in my pants.
Right.
And it's not. Like, it's not normal. It might be normal for you because you've gotten used to it, but you should know that if this is happening to you, there are things that you can do to, if not completely, totally eradicate it, or if you're not totally, completely like making it 100% go away, there's ways to at least really improve it, and improve your quality of life, and not needing to worry. It's not going to be on the top of your head all the time. You're not going to be thinking about it, like anxious about it every time that you leave the house. So let's jump in and talk a little bit about what the pelvic floor is. So I'm going to actually break out some anatomy for you guys.
Yay.
So let's get this all set up. And I'm going to start actually from a view. So this is if you were to basically be looking like a crotch shot from like down up, right? So if you were to basically like flip somebody upside down, this is what this looks like. So this is the superficial, the most outside muscles of the pelvic floor. And you can see like there's a lot of different muscles. Like each one of these guys is a different muscle. So I wish I had like a laser pointer so I could be more specific. But this is your superficial layer. And as you get deeper, I'm going to talk about the differences. As you get deeper, this is if you were to be looking from the inside. So those are your deep pelvic floor muscles. And there's, again, like a lot of them. I could go through all of the names, but I'm just going to be more specific of the deep layer and the superficial layer. So the deep layer, the purpose of those is to support your organ system. So you have some of your digestive organs, you have your reproductive organs in there, and I can show you a little bit clear. What does it look like when you have when you can see the bladder and some of the other organ systems in there? So I just really like this cartoon. You can see this right here, that's your spine and your sacrum, which is at the base of your spine. And then over here is your pubic symphysis. That's your bone that is basically right below your bladder. So if you have to go to the bathroom, if you're at all twisted in your pelvis, you can get a lot of pressure. So a lot of times there's honestly just a male alignment issue that if you can kind of fix that, you can do that manually. There's muscle energy techniques that you can do on your own to sort of use the muscles to sort of get your bones back in place. Then the organ systems will sit better. And then another thing happens is you have this layer right here. So if you see, all those organ systems are laying on this sort of pink layer. So that's the cartoon version of the superficial and the deep layer of pelvic floor muscles. So if those muscles aren't working properly, you're gonna get a stretch in these organs, and you're also gonna get just a lowering of the organs. So the combination of those two, the stretching of it, is gonna make the organ be like, I don't know what I do, because they all respond on receptors. So I know we're gonna get into more specifics of incontinence and all of that, but this is just sort of an idea of what the pelvic floor is. Like it's a floor of muscles that support your organ systems, And when they aren't working properly, or are stretched out or have trauma, you start to see dysfunction in the way that they support the function of those actual organs and all the muscles around it.
You know, we just got a comment about endometriosis, how it
Yes.
pelvic floor therapy has helped somebody with that. And again, like people who have like, you know, PCOS, endometriosis might not think of pelvic floor therapy.
Yes.
But, you know, we were talking about this yesterday, and I was saying how before I became an acupuncturist, I went to school for massage therapy, and there, you know, all we talk about is like healthy muscle, right? And how, you know, it's like we all know about like having knots in our muscles, like what we call our knots, and we're like, oh, like I have a knot here, I always have a knot here. But you can have knots in your pelvic floor. It's all muscle. So, you know, you have to really think about it too, really as muscle. When we just think like, oh, down there, and we're too, like, we don't want to really think too much about it, but like we can have like adhesions and knots, and that's going to cause health issues that you think are totally unrelated, but it is.
Yeah, absolutely. And, you know, I've seen a lot of patients with endometriosis, and for people who don't know what that is, it's a condition where you just get these irregularity of cells in the tissue, and it can kind of like push and pull, and it creates these like tight fascial adhesions. It presents a little bit differently in different people, so I'm not going to go too deep into that, but people generally have a lot of pelvic pain in, again, a bunch of different ways. Per their situation and their clinical history. But yes, I think this is a great time actually to jump right into fascia, actually, because I know that you deal with fascia, and I want to ask you right after I'm done with this about chi, and how does chi like interact with fascia and the meridian lines. And so I'm going to bounce that to you in a second, Z, because I love hearing you talk about chi and how it affects the fascia. It's just like so my jam. But yes, fascia is a connective tissue. It's all over our body. It's all over our muscles. It's all over our organ systems. And there's going to be different kinds of fascia in different parts of our body to support the function. So you have your IT band or your plantar fascia underneath your foot, where that's a little bit thicker. It's a lot more fibrous. It's more supportive. And then you have fascia that's a lot thinner, like over your organ systems. And that allows for that malleability and that flexibility. You need that movement. You need to be able to have, you know, that literally flexibility of the organ systems to be able to perform whatever functions that you need. So when there's a problem with the fascia and there's restrictions, you could have an issue, you know, somewhere in your shoulder, and it could be coming from your hip. It happens all the time. We get these cross patterns. It happens also because of the way that you have opposite formations when you have gait, that if there's something wrong with like your left hip, it could show up in your right shoulder because it's pulling on that. So every time you walk, it's like pulling on that opposite shoulder. And sometimes you can just release something in the hip, and then all of a sudden the mechanics are better. Not only are you peeing in your pants less, but your shoulder feels great and just your overall movement. So that's the most, I think, amazing thing about the fascial work is you come for a problem, you tell somebody where your pain is. And I know that you see this too, Z, where somebody will be like, oh, fix this for me. And then you're like, well, that's actually, first of all, we don't fix you, like we fix you together. And then the second part is that, you know, usually somebody will show you, this is where my pain is, and then we'll go somewhere else because it's usually coming from somebody else, from somewhere else, and that's where the symptoms are. So I feel like that's such a good segue in like, what is chi, and how does that relate to like, okay, if you're putting a needle in my nose, like how is that affecting what's going on in my pelvic system and with my bladder system? Like,
oh my gosh. Okay, so I love this because this is really for everyone, like East meets West at its finest. Because I often, when I'm doing acupuncture, people get really nervous because they're telling me about their shoulder pain and I'm putting needles in their hip and the opposite side. And they're getting really like, no, but I told you my shoulder hurts. And they think that if their shoulder hurts, we put needles in the shoulder. But that's really not how acupuncture works. And again, it's because we are working with fascia and fascial planes. And so we have this understanding of the body of how things are traveling, like what mechanism is going to be broken somewhere that we need to fix elsewhere. So the quote we always say, which I think you'll like, is we'll say the light switch isn't next to the circuit breaker, right? So so you have to look at the body like a whole system. You know, I get very hesitant sometimes to talk about, you know, serious philosophies in Chinese medicine that are thousands of years old because of how people might perceive them. So like concepts like qi, yin and yang, 5 elements, these are really like the fundamentals of Chinese medicine. And people just get nervous when I talk that way. So, you know, I kind of like I want to be clinical, so I don't say that. But really, this is our medical jargon. This is the language that we use as practitioners to describe phenomenon in the body. And what's important for people to understand is that 2,500 years ago, when they were developing the medicine that I'm practicing today, they created their own legal jargon based on nature, based on the things that they looked. So they observed nature and then they wrote about it. And then they wrote about it in terms of like Taoism, Chinese philosophy, Buddhism, like so many different things are influenced by this, but then also Chinese medicine has developed out of these philosophies. And so we'll look at the body and we'll talk about concepts like qi and yin and yang. And so really, it's so easy to explain in Western medicine. Really what qi is, and people, it's a translated word, right, into energy, or sometimes you'll see life force. But again, like there's no translation for this word. It doesn't like, there's not like a great English word for really describing what it is. But when we were in biology, this is always what I tell people. When you were in high school biology class, if any of you remember this, you learned about qi. So you learned about this cycle that our body has called the Krebs cycle. And so the Krebs cycle is basic, and a lot of us had to like memorize it and are scarred for life. But we would say how, you know, oxygen and glucose create energy. That's what ATP is. So it's bioavailable energy. So it's the energy that we need to move. For our muscles have to have energy to move them. Like we need energy to do anything. Our organs need energy to function. And so that's in Western medicine, they call that ATP. In Chinese medicine, we call that qi. So in Western medicine, right, we're talking about glucose, we're talking about oxygen. But 2,000 years ago, they had a formula, and this is like in text from 2,000 years ago, that said like food qi and air qi is wan qi, is your source qi, is your energy. So the food we eat and the air we breathe is what makes up our energy. Same in Western medicine. So again, it's like people get freaked out about like the crunchy granola-is of it all, but it's also just science. Like Albert Einstein says, like everything is energy, and like that's that, you know, everything is energetic. So you can't really like separate out these concepts. And so like even in terms of pelvic floor, like what does this mean? Like why am I talking about qi? To understand what qi is, we talk about qi in terms of like every organ system or meridian system. Again, these are like fascial planes, like according, you know, what Joe would call a fascial plane, I would probably call like a meridian. Again, like all different language for the same concepts. And so like the uterus has its own qi, it has its own functioning, it has its own job in the body. The kidney system does, the liver, the spleen, and it's not even necessarily like the organs we're talking about as much as it's like qi system. So how these organs work within a system of each other. We never separate out any body part. So whereas like in Western medicine, you know, if you have a headache, you might go to a neurologist. If you have like stomach pains, you might go to GI. In Chinese medicine, we are looking at every single process and system of the body and creating a pattern. And the goal of acupuncture is to correct qi flow. So when a person is healthy, that means there's a smooth flow of qi. That's what we say. Smooth flow of qi, you're healthy. Yes. Pain means that there's a stagnation. There is something blocking qi, or there's a directional flow of qi that's incorrect. And the pure goal of acupuncture is to correct the flow of qi. And we do that through the use of needles. And that's really all that is. That's like a way oversimplification, of course.
No, you know, I also just love this idea of energy and stagnation, and that there really isn't, like you said, there isn't one way to say that. And you really can't have one without the other. You're not really ever going to see stagnation with energy in my experience without also like a physical and structural restriction.
Yes.
And vice versa. If you have a physical and structural restriction, it blocks the flow. Like they are one. Like we are a system. We can't just be like, my wrist has nothing to do with my left ear. It's not actually what's happening in the body and the way it flows. And a lot of the integrative manual therapy techniques that I've learned over the years, which is a method by which you take a lot of the more westernized mechanical osteopathic techniques, and you combine that with a lot of the more modern like fascial discussions, as well as some of the Eastern like meridian lines that I know that you specifically work off of, and you just can't take one and not think about the other. And I do a lot of light touch manual therapy where even if I'm doing work on somebody with a pelvic floor issue, I will sometimes be on the inside of their foot or on the lateral malleolus on the outside of the ankle. And it's just, there are certain spots that just go right to it. And they're like, all of a sudden they feel like a lot of pressure that's decreased, and people just feel it so differently. And there's no like one thing that's going to fix everybody. There's not an umbrella, like, fix it all, technique for everybody, for everyone. But I think let's maybe dive a little bit into specifically, there's so many different issues in pelvic floor that we could talk about, but we wanted to focus on one of the more common issues, which is people who are having some kind of incontinence, specifically urinary incontinence issues. And we wanted to focus specifically on women, and it doesn't necessarily mean that you have to have had kids to have these issues. And so maybe like, let's talk about why would you have an issue with your pelvic floor, right? Like, why would there be a problem with those muscles that I just showed you on the diagram? Why would there be an issue with those muscles? So it could be anything, even if you haven't had kids, which is a form of trauma. Y'all are superheroes, all you moms. I tell you guys all of that. What your bodies go through. It's just amazing superheroes, all of you. But even if you don't go through a traumatic pelvic, experience like birth or pregnancy, if you have a hard fall on your tailbone, which means basically if you've ever played a contact sport, or fallen down the stairs and hit your butt really quick and were sore for a few days and just didn't think of anything like that, that it would cause any issues down the line, it can. And those fascial restrictions sometimes take years to have effects later on. So that's one way that you can have issues, is from trauma. And sometimes just overuse of the muscles. If you're an athlete and you're working out all the time, and you're maybe getting knots and trigger points, these taut bands that actually cause ischemic responses, a decrease in oxygen to your tissue, can make other muscles jump in and have to work harder than they have to, which are your smaller hip stabilizers, like your obturator and your piriformis, that aren't supposed to be your main stabilizers. Those are supposed to be your glutes. But if your glutes are working so hard because you're working out all the time or you're playing sports all the time, that's another reason there could be some kind of imbalance, in addition to whatever people's clinical history is, if they've taken falls, if they had sexual abuse and trauma. That's a whole nother topic.
Right.
But that's a huge physical and emotional reason why there could be some kind of issue or imbalance. And I'm sure you could speak to that on what that does energetically. If you have some kind of trauma, especially like sexual abuse, of course, that's going to cause all sorts of issues. So specifically to urinary incontinence, I would say that is one of the bigger ones. If you have a hip imbalance and you're weaker on those main stabilizers, so getting glute strengthening, and also being weak, but having like a shortened but weak pelvic floor. So you could think that you're strong because you're strong in a short range, but you could think you're doing your Kegels properly, but sometimes you need to actually go in there and release some of the tissue and then learn how to do those Kegels properly. So there's different kinds of Kegels, right? There's sort of quick ones, quick and release. There's longer endurance. There's like the strength one, the power ones, where you're like hold and you're about to sneeze. And also sometimes it's not about that. And I know Zahava, that this will speak to you, that it's sometimes about like, are you able to relax your pelvic floor? And sometimes the relaxation and letting go of that muscle is equally, as much of an issue as being able just to contract them, altogether. So I think that's a good place to start. If people have any questions about any of that, feel free to.
I think we do have a question.
Yeah, absolutely.
Joe, can you talk about manual therapy and what that means?
Yeah, who is that from?
That's from my friend Liz, cousin.
Okay, fantastic. Hi, Liz. Oh, so many beautiful souls that just popped on. Hi, everybody. It's so nice. Yeah, it's so nice to see everybody's names. I miss you all. Yes, I would love to talk about manual therapy. So most people don't know that you can get manual therapy on your pelvic floor because they're like, how does that work? And I remember the first time, I was telling you this earlier, Sahava, the first time my brothers were like, you do what? And you're like, you get in there? And yeah, you do. You can get a glove on and use lubrication. And usually we do manual therapy just with one finger, especially for people who are really like sensitive for conditions like vaginismus or endometriosis, where people sometimes have a lot of tenderness. So we're very, very careful. And you do an exam like you would any other musculoskeletal issue. So we start, with a lot of history questions. And then when we do the internal work, I'm basically palpating really superficially, really gently on those superficial layers. And then getting deeper. And then again, like maybe one knuckle in and then palpating all those muscles, and then two knuckles in, and then again. And we work based on a pelvic clock. So sometimes it's hard to tell, like when you're in there, if you're getting the treatment done, which I've also gotten done, you're like, where are you? You like have no sense of like where the person is, especially with a lot of the referral pain. You can like put your finger on, a tender muscle and you can feel it somewhere else because of the referral patterns. And so that's actually how we give people self-treatment and self-care tools to do, is we'll be like, this 3 o'clock or this 4 or 5 o'clock area is really tender on you. And so what we do when we're in there actually doing the manual treatment, everybody does it a little bit different. My style is usually when I do a trigger point release, again, just like any other muscle, I'll do a long holds where I'll find that tender spot. And then I introduce a lot of breath work. So if you're doing something really intensely, or you're trying to like really like strum out like you would like on a back muscle or a shoulder muscle where you're really trying to knead, you're going to see the patient kind of guard like this. So the manual work is going to be like finding a spot and then breathing into it and making sure the patient is comfortable. I'm not like moving around a ton when I'm in there. So that's a great question, because everyone's like, what is manual therapy? And then sometimes I'll have people do active release as well. I'll have them do a specific motion while I'm on a trigger point internally. And that gets the fascial system to be a little bit more open through motion. We call it an active release technique. And also manual therapy consists of checking to make sure people are doing Kegels properly. So I'll usually check a Kegel before and after I do some of that manual treatment. And I'll have my patient do a Kegel, have them do all 3, just like the quick and release, the elevator one where you'll kind of come up, holds, and then relax and totally bear out. And then I'll do the release work and then have them do it again. And it's amazing. Sometimes in just 20 minutes of treatment, you'll see a huge change in recruitment of the proper muscles, making sure you're not compensating too much with the adductors or any of the other hip muscles that aren't involved in the pelvic floor. So there's obviously a lot more that you can do manually. Besides this, you can do a lot of motility work, making sure the bladder and the uterus is moving properly. But in general, that sort of initial assessment and trigger point release is pretty standard in a lot of the therapy that I do. Thanks for asking.
Okay, so also, yes, anyone feel free to ask any questions at all. We are so happy to answer them. And also, there were so many different topics that Joe and I wanted to discuss tonight. So if we do another series, we might be doing more series. There are so many other things that are important to speak about, not just incontinence, although that was like needed to be needs to be
Yeah.
addressed for sure. So just feel free to email either one of us also, and we can answer questions confidentially too.
Yeah, because we know this is like a super sensitive topic, and not everybody wants to throw all this stuff out there on Instagram. I think once you're like in a health and wellness profession, it becomes like a little bit easier to just like talk about your body, like
Yeah.
the fact that I've had pelvic floor work done, and as a student in the learning process, and it's so much more normal. I just want everybody to know it is so much more normal slash more like common than you would imagine. And so the more people that talk about it and come and get help, the faster you can just sort of like go on to that next level of wellness and the things that you're working on. And I would say actually, Zeke, can you tell us more about like the kidney and the ureter meridian and bladder meridian, and how is that involved with incontinence issues or pelvic floor issues?
Yes, that's like such a good question.
Yeah.
So basically we were talking before about like the concept of qi, right? And how, when they were developing this medicine thousands of years ago, they looked to nature to describe like phenomenon in the body. So one of the ways they do that is they talk about the body in terms of nature, in terms of like climate. So we'll describe the body and we'll say, this is damp, this is dry, this is, too hot, this is too cold. Like an example is like inflammation, right? That means there's too much heat, and that's the same in Western medicine. So often we'll see with pelvic floor things like, one of the things we treat a lot actually that people don't realize is like excessive vaginal discharge, things like that.
Yeah,
or
absolutely.
just like chronic yeast infections. And so in that way, we would say there's too much dampness in the lower jiao, which is like it's translated into like the lower orifice, but it basically means the organs that sit below your navel, right? So like some digestive organs and reproductive organs. So those are like your lower orifice organs. And so when there's too much dampness, often when we eat too much sugar, which causes right, which causes dampness, or too much dairy, then we'll see those types of issues. Like in pelvic inflammatory disease, or right, like things like endometriosis, like there's actually like physical like clotting that can happen, and that's like we call that like blood stagnation, like your blood is literally stagnating. So the term sounds funny. So when I talk about kidney qi, also it sounds funny. Is she talking about my kidneys? Is there a problem with my kidneys? No. I'm not talking about like the actual two kidneys like sitting there, but I'm referring to a system in which the kidneys work that affects other parts of the body, and also how the fascia of the kidneys works and connects to other parts of the body. So like the kidney meridian, for example, starts on the bottom of the foot and ends like up here by your clavicle actually. So this is like a whole body system. And so it's the job of the kidneys to control the lower orifice, so to control those organs and that space in your body. And when you have incontinence, it means that there's a weakness in the kidney qi usually, because the kidneys are supposed to be holding everything in place, right? It's helping the pelvic floor lift and support those organs. And so when there's any sort of prolapse or weakness, and so we're having leakage, that means that our kidney qi isn't strong enough. But you don't have to fret, because there are ways that we can solve that problem. But it's really important to understand that in Chinese medicine, when we talk about the kidney qi, we're talking really about our essence of like who we are as a person. And so what that means is, we're born, right, with DNA, right? So we're born with what we have. But then at the same time, we grow up and we have our environment, and we have lifestyle choices that we're making, like what we're eating, how much we're resting, how much we're taking care of ourselves. So those two things combined is what makes our essence, is what makes like what we call the kidney qi. And so there are things that naturally happen in life that deplete our kidney qi. So for men and for women, as we age, our kidney qi weakens, and then you start seeing incontinence. So again, not related to childbearing or anything, but for men as well, right? Men, their prostate issues later, but that's like a kidney problem for men as well. And so like when there's like excessive ejaculation for men, that's also a weakness. Like there's not this holding that should be happening. So there's a weakness in the kidney qi, and so we do what we call like tonification. We're trying to tonify that qi. And so another really good example is like low libido too, which is very common, especially in women. But so low libido too would be like usually a symptom, like a sign to us, oh, we should really look at other signs and symptoms to see if there's like a kidney chi insufficiency in this person. But then also there are things that just deplete our kidney chi, just life cycle events. And like the main one is like childbirth. So you have this like essence, right, that we've described. So it's like the lifestyle and your DNA, but things like giving birth, right? We're giving over kidney chi to someone else, and we're giving them our blood, our essence. That's going to deplete us too. So there's just certain things that are, and it's natural. It's not necessarily a bad thing, but in China, oh, hi, Emily, my sister-in-law. So, in China, we'll see there's something called like the first 40 days, which is when a woman has a child for the first 40 days, she just sits around. She doesn't do anything. She doesn't stand up. She doesn't get up. She doesn't cook. They bring her the baby, they take away the baby, and they just like cook her nourishing foods, like according to the Chinese medical diet, to just like help nourish her kidney chi. But again, we don't do that in Western society and in Western culture. So, and not only do we not do that, but we're living in a society where we're all about productivity. I mean, and I'm totally guilty of this, but like, we're just like kind of like stressed out, go. Like when we're eating, we're working. And so these are things like these lifestyle things are depleting us. And so what the main point I want people to take away from this really is that
oh, sorry. No, I wanted just to add in really quickly because you were on this like amazing role of like also hydration into that whole system about how important hydration is. I know like I could speak to that from a fascial, but also from an energetic, like water carries energy. Sorry, go. Keep going.
I love it because yes, water is the fluid of the kidneys. So yes, water intake is 100% going to affect your chi. So chronic dehydration, we force women to stand at a brisk 8 to 6.
I see that.
That is like I tell you, I've been there, Liz, and it's like the most horrific. It's the most horrific experience. And so basically, I think the most important takeaway, like as I'm blabbing about like all this stuff. Ooh, are you frozen? Oh, there we go.
I'm good. I'm here.
The most important takeaway is that the lifestyle choices that we make now, how stressed we are now, what we eat now, how little we sleep now, can lead to incontinence. It's depleting our kidney chi. So we may not see the effects right now, but when we age, we will not age as gracefully if we're not tonifying and nourishing that kidney chi, which is really, Chinese medical speak for wellness, taking care of yourself, nourishing yourself, proper rest, proper sleep, proper food, proper nutrition. And so, so unrelated to childbearing as well, being too stressed, working too much is going to deplete you, and you can later have issues like incontinence. So I will say, as depressing as that sounds, there are really great things that we can do to nourish our kidney chi at home really easily. And also there's like another thing is like when we talk about burnout, right? Everyone now is like talks about burnout. That's really what we're talking about. That's the same as kidney chi. So that's what I want people to think when they hear kidney chi is just like, it's a way to talk about burnout pretty much. But we can eat, so in Chinese medical nutrition, different foods have different energetic properties. But again, in Western medicine, it's the exact same thing. Like red fruits and vegetables have lycopene, right? So they're good for heart health. So black and deep purple foods have anthocyanins, I'm sorry if I pronounced that incorrectly, and flavonoids. And so these are actually foods that promote aging. So, no coincidence that the black foods black also, is the color of kidneys in Chinese medicine. So every organ system has its own like representative color. So we eat black foods for kidney chi because black represents like our aging and our kidney chi. So foods like, first of all, black sesame seeds, that is the biggest tonic in Chinese medicine. You sprinkle it in your smoothies, on your salad. You just eat black sesame seeds day and night. But black beans.
I was
purple
thinking yesterday.
cabbage, blackberries, and then elderberries, and also like any nuts and seeds. Those are things that really tonify the kidney chi. So really easy to incorporate a lot of those foods. And then I'll say also the best exercise to do to promote kidney chi is qigong. So qigong means gathering chi, and it's a way, it's just like breath movement. And it doesn't matter if you're doing qigong, tai chi, yoga, yes. But doing exercise like that, it's not, it's not like your HIIT workouts. It's not like CrossFit. It is like really, really nourishing, like breathing meditation that is going to enhance your kidney chi as well. So to end, I want to say stress is aging you and depleting your kidney chi, and we all just need to be extremely careful about that. But also, like when you do see the issues, like when we see in Chinese medicine issues like incontinence, we always think the first thing we look to is kidney chi, and we will see patterns like other signs and symptoms that usually come with incontinence. So if there's also achy knees and low back pain and like a lot of like vaginal discharge and fatigue, that is a kidney chi pattern, and that means like there is like a real issue with your kidney chi. So typically it's not just incontinence alone, but it's like what other signs and symptoms are you having with your incontinence that can lead me to a diagnosis that we can fix with acupuncture. So,
Yes. Oh my God. It's so good. It's so good. I mean, I want to dive so much deeper and be like, what are the most common points along the kidney chi? I mean, like there's so much for us to, I don't know if we have time. Can we talk about like common like acupressure and meridian points that are along the kidney? I would love to hear about
totally,
that.
yes.
Okay,
so the best one is right on the bottom of your foot. Like deep right under. So this is, I'm mirroring it on the hand so you can see, but like right here, it would be on the foot. So like right where you meet between usually like the second and third toes. That's kidney 1. And that's also a big headache point, but it's for grounding. So it's an extremely nourishing acupuncture point. And when there's a real incontinence issue, that's a really good point to go to. And the last, there's another point on the inner ankle too, about 2 inches above like the, I can't show you because I'm like under a table, but about 2 inches above like the ankle is a point called kidney 7 too, and that's a good point for any sort of like water dysregulation, like water metabolism issues. So like incontinence, any urination problems, but also to tonify kidney chi. And then I'll also mention kidney 3 is like the source point of kidney energy. So in almost every treatment, when there is a kidney issue problem, you're going to have kidney 3 needled. And that's also, sorry, I can't, I can't show my feet right now. But it's basically also in between your medial malleolus and your Achilles. So it's the point right in between there. Thanks for demonstrating. Yes, perfect. Yes, and there's a few kidney points around the ankle there. But yes, doing acupressure on those points is a great idea. And then the last points on the kidney channel are right here. So it's like where your clavicle and your sternum meet in the corner. And the trick to remember that in our school was it's like, this is like your sternum and your clavicle make a 7 shape. And so it's 27. So 2 sevens. You know what I mean?
Yeah, I love it.
And this is actually a good point for like proprioception and a lot of like energetic work that's not Chinese medical related. They'll hold on to these points also as grounding points for balance, to help people with balance, like who have vertigo and things like that. So those are really good points to know. I'm like, that's such a great question because people can be doing this at home for sure. And I'm also happy to send out pictures.
Yeah, because I send people homework all the time, and it's different. You're sometimes doing more direct, specific fascial work where you have a ball and you're breathing into it. But sometimes it's honestly just putting your hand on a point, and you're basically, talk about energy. You're using your hands basically as electrodes to stimulate like input and feedback to the brain. And you can breathe and you can do breath work, and your mind can tune into specific areas. So if you know the points that you're supposed to be, so I also use, adrenals and the kidneys, where you can be having the back of your hand like pretty much a hand width below your shoulder blades. And so that's where your adrenals sit. They're hormone producing organs that sit right on top of your kidneys. And the kidneys and the adrenals are really responsible, as you was talking about, for stress responses. And those stress responses, they also get held, guess what, in your hips and in your pelvic floor. And sometimes just doing the breath work with your hands, 5 grams, which is just a nickel. If you put a nickel on your hand, that's how much weight you should be feeling. And just that small feedback of just feeling your hands on those 2 points in your back and breathing for 2 to 5 minutes, 2 to 10 minutes, however long like it feels like you need to sort of just sink in to your body. It's so much of the time just sort of tuning in. What do you need? When do you need what? And how do you get more resources if you feel like what you're doing isn't helping? So there's a million different techniques that you can do probably to get the same result. It's sort of like what works for you in that moment, and gaining things for your toolbox. And today, Miss Zahava, Dr. Zahava, I got some new toys from Chicago Acupuncture. I got a tour. I feel like I'm like your promo model right
You
now.
are.
It was so much fun. If you've never been to Zahava's office, it's adorable. It's so beautiful. I went to her one in Glenview, and I got my self-release tools, which I freaked out when she launched them because I was looking into productions. I was like, I don't need to make this. Zahava's already did, and these are like amazing. It's made of quartz, rose quartz, right?
Yeah.
Yeah. So, which is a heart chakra stone too, if you believe in energy, whatever. It's a thing. And you said you like to use these on the mandibles, right?
Yeah.
I'm sorry, on the masseters, which is a muscle that goes to your clenching muscle right here. And to the jaw as well, because of the way the cranial bones move in synchronicity with the pelvic bones and the sacrum. There's actually a bone in your head, the sphenoid, that basically looks like a sacrum, the bone at the bottom of your spine. And so with form comes function. So it's amazing. So a lot of times doing work where you're releasing the masseter right here, and even getting inside your house. Obviously COVID, you're washing it a million times or putting a glove on when you kind of go into the corner, can really, really help. And you're just sort of breathing into that. And the roller, it's like also really great just to increase blood flow. But I also really love to use these rollers. I'll take my palm, and once I find that spot where it pops out and I'm on that muscle, I'll even sometimes like lay down like this on the floor, and I'll just get it on a spot, and I'll just breathe into it. And what you want to do is find a tender spot and just really relax into it. And then you're making these just like minor micro adjustments to be able to follow the release and to be able to follow what we call a fascial unwinding. And it can be really powerful, and you sometimes actually can feel it down in your pelvic floor, which is wild. So I definitely recommend trying it. I always encourage people to get an assessment and talk to like a health professional or a health provider if you really have serious pelvic floor issues. But besides some of that self-release work, I would say the tennis ball in your glutes is another great option. And so what you can do is you can find anywhere in that glute, so the top of your pelvis and the bone that sticks out here in your hip, anywhere in between that is fair game. I'm gonna post something actually in the next couple of days on my feed of like how to find this and ways to sort of make it harder, or make it more intense if you're not feeling it. But it's the same idea, just breathing into it, making micro adjustments once you're in it, and really just relaxing throughout the entire leg. You could be there for 2 to 10 minutes, and then try to do your Kegels, because sometimes releasing the glutes will cause a reactivation or a shift in the way that we activate our pelvic floor muscles. So that the TFL is another one, which is a little bit closer to the front of your pelvis. I'm sure that you do that one all the time with acupuncture, because there's like
that's a good one.
crazy trigger points with that. So I think the other, things that you can practice are really just making sure that you're getting also that transverse abdominal engagement with the Kegel. So the Kegel is basically just stopping, that flow of urine, but then you also want that lift. You want to feel like you're kind of lifting up literally your organs. Imagine that you're kind of going to that second, third floor and then holding it, feeling those deeper core muscles that are going, the fibers are going this way. So you're not crunching through, you're sort of engaging with length and then exhaling. And why is the breath so important other than just energy flow? The breath is so important because the diaphragm fascially is also so connected to everything else that's going on in your thoracic and abdominal cavity down to your pelvic floor. So expanding through the rib cage, expanding the fascial system through the rib cage, through the lungs, through your diaphragm, all the way down to your pelvic floor, and constantly connecting, like, what am I feeling breath-wise as I'm coming up, exhaling, and exhaling, everything kind of comes together. So just being in tune instead of just kind of like doing releases, doing Kegels, being bound down while you're doing Kegels is like the worst thing that you can do. You want to really try to focus in on the breath with that. So I think those are like my biggest takeaways. I'm again happy to take any questions if people have. I might actually just check my email really quick just to see if anybody chimed in.
Yes, please ask questions.
Yeah, so we'll just kind of take a second to sort of tune in to see if there's any behind the scenes feedback.
Okay, I'm going to do that as well because I did notice I was getting some messages. Mm-hmm. And then also I'll mention, like, while you're looking up messages, I will say that when you were talking about, how the adrenals, right, these glands sitting on top of the kidneys, and even just like placing a hand there, that's also like that connection when I was talking about kidney chi and how it relates to stress. Like your adrenal glands are what's responsible, right, for stress, for it's producing cortisol, your main stress hormone. And so again, like nourishing life is going to give you kidney health. It's going to help with your incontinence or any other pelvic floor issues that you might be having. So just don't forget the importance of really like mind, body, soul, how like all of it's a unit and all of it's affecting the next thing. So don't think that like, oh, well, it's because I had a baby. And so, me and my friends also, like the fact that you and your friends talk about like that, you all pee yourselves, like even though it's common, doesn't make it what's like physiologically normal or should be happening to. So,
No, that's so great. I think we're good on questions, but that's such a good segue into let's maybe take a minute and talk about like, well, why is pregnancy and childbirth so traumatic for those who haven't had kids or for those who've had kids. It's like there's a lot of different things that can happen. Anything from the superficial tearing of those muscles and that fascia right at the perineum between the vaginal opening and your anus. So that is like one issue that can happen. And then another main issue that often happens is you get the stretching of all of the tissue in your abdomen and in your transverse abdominals, which are the main supportive muscle in your core. That's the most stabilizing muscle that you have deep in your core is that transverse abdominals, this sheet of muscle that wraps around from here all the way to your spine that sits like this. And it gives you stability throughout your spine and your pelvic floor, and it works in conjunction with your pelvic floor. So when you have all of those muscles stretched out with possible tearing and also just pressure, and what also happens is the hips start to open up to make room, and the pelvis starts to open up, and you also get increase in laxity in those ligaments, which is normal, right? To start to prep the mom for being able to push a beautiful soul into this world. We have to be able to stretch those ligaments and that structure to be able to fit it. And so what happens when you have that laxity is the muscles have to work so much harder to create more stability. And when the muscles have to work that much harder, you get more trigger points, which means you get that increase in ischemic response, which means everything is kind of functioning and firing out of whack. And then you have all of these different ways that it can show up in the body, one of them being incontinence. So
Yes.
the bladder, especially, it sits right above that pubic bone. And so you're having the weight of the baby, you're having like stretching, extent, like everything is just pressure, 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 pressure. So if you have on top of that already maybe a pre-existing weakness that maybe was there before you even got pregnant, that's also setting you up. So definitely, if you have the opportunity to even get checked on or getting a checkup, we're way better. We're way better as humans about it in Europe and in France. It's like a part of their healthcare system where you go and you can actually get a pelvic floor exam 6 weeks after you have a baby. I'm pretty sure they have like pre pregnancy appointments as well. And even if you don't have any issues, even if you're not peeing in your pants and you've been cleared for exercise, you get sent to the pelvic floor therapist. They do a pretty quick but thorough exam of like, is your pelvic floor firing properly? Does everything look and feel normal? Are you able to orgasm? Are you able to have sex without pain? It's like so crazy, but there's actually, I'm not sure if it's still like this in DC, but I'm pretty sure that at least until recently, but for a long time, women couldn't get that as a diagnosis, inability to have an orgasm. It only counted in insurance if that was the case for a male, because it wasn't seen as a functional deficit, because theoretically, right, we can get pregnant without having an orgasm, but men, aren't gonna be able to like do their thing and then shoot their semen and get this reproduction process started without that. So that's a whole nother conversation again. But going back to it is like, if you have the opportunity to get a pelvic floor assessment, if you even have an inkling that there's anything going on, if you have an opportunity to start doing strengthening and release work before you're even trying to get pregnant, definitely this is the time to do it, or start searching for opportunities to just look into it to make sure that everything can go as smoothly as possible, because it's a crazy process having a baby. I haven't had one, and I just see everybody go through it, and again, y'all are superheroes.
Well, we're gonna get cut off in like
Okay.
50 seconds.
Okay.
So I also just want to note, I don't think we mentioned this, just that with incontinence, because that's really what we're talking about, that if you do have an issue, yes, you have to get checked by your primary care physician, because sometimes incontinence is a red flag for like neurological disorders and other more serious things. So I will say, like, first, always make sure that you get checked by your physician, and then you can seek alternative therapies to help you. And I just want to close. We're going to get cut off, but Joe, I love you. This was amazing. Please, you guys, send us your questions. Oh, there was a question. This is being recorded, and we will get it out to you.
Yes, and also we have workshops, and both of us are doing like all sorts of things. Z has her stuff.